think the first goal of our research is actually to kind of define the genomic alterations that are seen in human lung cancers. Once we know those alterations, we want to try to understand how do these function in the cell. How do they change the function of the lung cancer cell? How do they participate in the abnormal growth of the cancer? How do they promote the growth of that cancer? And as we come to understand that, we want to say, how do we disrupt that abnormal function and use that information to find the weaknesses of the cancer cell, to kill the cancer cell, and to help patients recover from their cancers? Our goal is to improve cancer care two ways. One is through better diagnosis, by understanding more precisely what happens inside patients' cancers, and especially their lung cancers, and how to use that information to separate cancers and even to identify what kinds of treatments they might benefit from. The second goal is actually to say, can we use the knowledge of the genome to define new targets for treatment and to identify molecules that will therefore be able to treat cancer. Funding from the American Cancer Society has been a really important part of my research. When I started at the Dana-Farber Cancer Institute, I was awarded the Research Scholar Grant. More recently, I've been awarded the American Cancer Society Research Professorship, and that really gives us a lot of flexibility to pursue new and creative ideas that we wouldn't be able to do otherwise. And that's really the great thing about this funding. One of the big things that drove me to cancer research, and lung cancer in particular, was an experience I had as a third-year medical student when I was taking care of an elderly gentleman who had just been diagnosed with lung cancer. And the thing that bothered me was he had been ill for a long time, been getting sicker and sicker, and he never actually chose to come to see a physician. And then I realized, when he was there in the hospital, that there was actually nothing that we could do for him. And I thought, well, his decision maybe hadn't been so bad. And I wanted to be able to change that for patients and make it worthwhile for them to get their cancers diagnosed and seek out their treatment.